Coach, you might know her.
I do.
All right, the Finance Committee will come to order, please.
Oh, okay.
Are there any citizens who have signed up to address the committee? None today. We'll move on to item number 3, which is approval of the minutes, which are in your book. I'll entertain a motion.
Move approval.
Motion by Mr. Bowe, second by Mr. Powell. All in favor, please say aye.
Aye.
Opposed? Motion passes. Item number 4, CFO report. Boss Clark.
Before you get to that.
Yeah, oh, I'm sorry. I'd like to recognize Dr. Weber for some
The,
announcements.
there was a diversity summit last week. I thought maybe Ralph would be here this morning.
He's on his way, so if you want.
Well, let me say
Oh,
that.
as a matter of fact,
Okay,
he's just
he's
walking
here.
to the door.
I thought he might say it under his chairman's report. But it was a great diversity thing. I wish they had 4 panelists that answered questions. I wish they could have stuck around a little longer to hear some more. Hey there, I'm just talking about the diversity summit. And there are a number of takeaways from the summit. The obvious thing was diversity, but did learn some things about a couple people. Number one, the CEO, Mr. Early, by self-admitting he's a skinny little white man. But would we be willing to take on Russell Crowe in Gladiator when the cause is right?
I like it.
Fair?
Fair.
Okay.
Fair.
The second one was Reverend Emerson closed the session at noon on the second day, and he talked about some personal things that I would never mention. I mean, those are stories that can only come from you. But part of it was somebody lost an earring. Now, at a diversity summit, you can't say she lost an earring or he lost an earring. It has to be someone lost an earring.
Right.
Well, after Emerson was giving his talk, he admitted that the earring was his. So as a measure of solidarity, I went and got my earring. And I just wanted to, because I dared him to wear it, and I can see that he did. I'm gonna wear that.
Perfect.
He's just over there shaking his head. He's wondered, why am I in this meeting again? We're not done.
Oh,
No. But it was a very good, I know it's not part of the agenda, but it was a very good diversity summit, and all of us that came to that learned something. I
Good.
think we're all enriched by being there. It's a good day.
Great.
Yeah, it was really exciting. I think that, and it really played into where Finance Committee sits because of the contracts, the vendor spend that we're doing.
Right.
That I think we're going to even see. What was really amazing to me is where we are with the vendor spend now when it comes to diversity,
Right.
and that we are way out there than where I thought we were, which was really great.
Making
to see.
progress.
Right.
Good.
But it was a great, I really would say I felt, if I had one major takeaway, was that it was well received by the employees. As I walked around the room, we sat at lunch and talked. It was a great experience for them, and I think we'll see that permeate throughout the district.
Good. Very good.
I have one last thing for you.
Yes, sir.
We were all assigned tables at this, and at each table was a country you were assigned to. And at our table, we were assigned to Egypt. And it was the Egypt lady that was translating for us here before, speaking
Oh,
Arabic.
yes,
It's
right.
the 4th most common language. At the table was Bill and I and Danny and Francesca, and then a lady named Mesa, who's a American Muslim, who put this together. And there's things like when you're greeting the opposite, the female must extend her hand first. And then only the male can then extend his hand. And if the female does not extend her hand, then all you should do is just bow your head, which is a matter of respect. But the thing that, probably got me the most when I was thinking about this meeting and Robert was, you should avoid eating with the left hand that is used for personal hygiene.
We lefties are in trouble.
I'd happen to picture you playing guitar with your left hand.
So noted.
That's it for this one.
Thank you very much for that. That's awesome. Mr. Wynn has now joined us. If you'd note that for the record.
Ralph took yours.
Morning, DT.
Ralph took yours, see.
And then we have, oh yeah, we'll do that.
As soon as Sharon's ready to go.
So Sharon, Ms. Boss Clark, please give us your CFO update.
Wait a minute. DT, you still wrong.
Before you start, courtesy from
Yeah, there it is.
There it is in writing.
So
It is
noted for the
official
record.
now.
It is official.
that's all.
Yes.
I am red, I can feel it. Wow. You know, I was just telling Diana to be quiet back there because it would slowly die if she just didn't say it out loud, but I'm afraid it will not.
It will not, no.
Worst nickname, so I do appreciate this one. It can be said publicly and I can still hold my head high, so I appreciate that. You have seen my org chart before. What you haven't seen is every box has a name in it. So, I'm proud to say, and I need to remind everybody that you are supposed to speak into the mics. We have not been doing a good job of that throughout these meetings. That was my job, and I can take my sticky off now. But yes, we are supposed to speak directly into the microphone or the video. Until recently, about 3 weeks ago, all of my boxes for my director level and above were not filled, but we have been lucky enough to hire the Director of Decision Support, and I wanted to take the opportunity in front of you today to introduce a portion of these folks, especially the newer ones. You know Kelly Shelton. She has come to meet with me several times. She's the Director of Managed Care. Since we did not have any contracts today and she was in training, I did not want to disrupt her training. So I will take the opportunity next month when we will likely have managed care contracts and she will be here. I will do this, I'll take a few minutes to introduce her in a similar fashion. But who we do have here today are some of the finance related people as well as Katie Rutherford and Rev Cycle. But before I did that, I was having a conversation with DT a few weeks ago, and I mentioned some stuff about myself, and he was like, "Oh, I didn't know that." So I'm gonna do that for myself today. And I don't know, he did not realize that I had graduated from Texas A&M and did not hold that against me. So I did.
He's the only one, by the way, who doesn't hold it against you.
Yeah, and I know, Steve, how you feel about that, but, yeah, so I got a double major, so it counts doubly against me in accounting and finance way back when. And, in 2008, I went through the executive program at TCU and got my MBA there. So, I bleed both purple and maroon. After A&M, I came back to Fort Worth. I actually grew up west of here in a small town called Weatherford. Still live there today. But came back to Fort Worth, worked as an auditor for Coopers and Lybrand at the time. Used to be a Big 8. but quickly went to Cook Children's, who was one of my clients. When I left there after 16 years, I was the Senior VP of Finance. Went out to Lubbock with Covenant Health System, stayed there for a little over 6. And both of those systems were very complex integrated health systems. They were multiple hospital systems, both had physician networks, lots of smaller companies, supportive companies, home health. So I was lucky enough to gain a lot of perspective throughout my career about startups, dissolutions, and then by chance meeting, I ended up at JPS exactly a year ago today. So
Happy
thank
anniversary.
you for that opportunity.
All right.
Yeah. And during my career, I have been lucky enough to work for 3 separate CEOs who have always put the patient first. And I think a lot of that has molded a lot of the decision-making process for me and patient care. So I don't think someone in my line of work has always had that opportunity, and that is luck, because not all CEOs are able to ask the question in every meeting, what is right for the patient? So that's kind of why I am who I am today, and I appreciate your patience and letting me take the time to build a team that I needed to build for the last year. It hasn't been an easy process, but it is one that I take very seriously. I think you have to have the right people here with the right attitudes. These pieces of the pie and this infrastructure is one that we will be using for the next 5 to 10 years to build the systems. So it's important that we do it right. And just because they're here does not mean that we're going to have these systems in place tomorrow. It's going to take diligence to create a lot of these systems that we're building today. So I'm going to thank you in advance for your continued patience, but we have the right people. So that framework has to be done right. But the first person I'm going to bring up is Gina Adler. A little bit about Gina. I've known Gina for about 7 years now. And she graduated from the University of Texas at Dallas. She has her MBA in accounting, and she is a CPA. Gina is a fellow of Healthcare Financial Management Association. That is a very difficult achievement to get a fellowship. It takes a lot of studying, a lot of achievement in that. And she's also this year the membership chair for the Lone Star chapter of the HFMA, which is the DFW area, but also expands in a large part of Texas. She came from Parkland to JPS, but she previously worked at Covenant in Lubbock as the VP of Finance. And for a total of 33 years of accounting experience, but 23 of that was actually in healthcare. So at JPS, Gina covers the general ledger, all aspects of that. She also has the budget and analysis areas, the cost reporting for Medicare and Medicaid report up through her. She also has materials management. That is a huge process that reports up through her. And also the Connection Medical Services reimbursement, where we pay the professional expenses for the physicians that see our Connection population. So all of that comes up through her. She is originally from Nocona, that huge metropolitan area just down 35.
Big city girl is what you're saying.
It is, yes. She's married. She has 3 children and 5 grandchildren under 5. 2 of those are twins, and 2 more in the adoption process. So there's a house full when her family gets together. She is a trustee for Preston Ridge Baptist Church. She loves to read, travel, and she is a runner. She finished her first marathon at Cowtown in February.
All right.
So anyway, I've asked each one of these guys to take just 2 minutes or so to tell you what some of their goals are for their areas in the next year, 12 to 18 months.
Hi, again, I'm Gina Adler, and I'm the Vice President of Finance here at JPS, and just very pleased to be here and just happy to be working with Sharon again. So just enjoy being at JPS and really like what we're doing here. So the goals that we have for next year, first of all, is just to hire people. We have a lot of openings in the finance area, so we have a lot of vacancies, and so we're just trying to get the people hired, and you're going to meet some of those that we have hired since I came on board in October. So there's several individuals that we have placed into the director level positions and some in the manager levels, and so you'll get to meet some of those individuals as we proceed forward. The goals that we have kind of set forward beyond that is to just shore up the finance area and make it stronger for JPS so that there's some reliability and dependability on reporting, timing, and validity of numbers as we proceed forward. The specific areas, some specific things we're going to get into is we're going to implement a cost accounting system, and Sharon's going to speak to that more elaborately a little bit later, but that's going to be a big process. That's a 18-month to 24-month process as we go forward, but it's one that's going to be big and big for JPS. Some of the other things that we're looking at is going to be updating our materials management system and just enhancing that and upgrading that. We're going to expand our RFID tracking process within fixed asset management, so we can track our assets. We've got them tagged and track them, so we can keep up with them, and they don't kind of walk out the front door.
Ralph's been threatening to do that to his board members.
Well, we can keep up with them. And then also just looking at the connection process, that's an area that is under my realm of responsibility, and the connection medical services reimbursement area is one I look at. Right now, we're going through a process of just restructuring that area and making sure we have things working the way we think they should be working. And so we're specifically evaluating what each individual is doing and just exactly what processes are in place there. And we're trying to put some things in place that will improve that whole process around our connection patients.
Great. Thank you.
Thank you.
Any questions for?
I
We do.
Oh. Maybe
Yes, sir.
part question, part statement. As you bring those employees on and those employees that you have, one of the things that I have continually pressed is that everybody in the organization truly knows what a destination metric is, and they know what they are and what the pillars are for our hospital. And so it would be good to hopefully that they would understand as you talk to them about materials management and the connection, is that how that relates to those metrics.
I think you're hitting on a very exact point, and I think it's one that we, at our LDI, we had an LDI conference on Tuesday just this week, and that is the destination metrics were definitely covered during that process, and everybody who was in that room, probably about 200 or so leaders, were exposed and given the opportunity to learn about what exactly those destination metrics were, the pillars, and our little pyramid, as you have seen too. So.
Thank you.
So the next 2 people I'm going to introduce, the first one is Ben Scott. He is our controller. He's been here for about 5 months, started in January. Ben, he graduated with an accounting degree from Oklahoma, Cameron University. So at least it's,
Not over you, yeah.
He has a master's in healthcare administration from UTA, and he's also a CPA. So we run in packs. He has worked in healthcare for 22 years. Part of Ben's responsibilities at JPS are everything that is general ledger. So that includes payroll, accounts payable, all of the reporting that, the collection of data that happens in accounting. There are 8 accountants that report up through Ben. He most recently came to us from Forest Park Medical Centers in Dallas. And he also worked with THR in their finance area before that. So Ben relocated to Weatherford when he took the job here at JPS. So I have not run into him in town.
Around town.
And,
How could you not?
I mean,
No,
there's
it's-
tractor supply.
There's 3 places.
Don't y'all stop at that one line occasionally?
Yeah.
And he has 3 kids and 2 grandkids. So, and then I'm also going to have him share a couple of goals for his areas.
Okay. Well, it's a pleasure to be here. I started working with JPS in January, and it's been a pleasure to be a part of JPS. In my past, I've worked with a couple of public trust hospitals in Oklahoma, and it's, there's a lot of satisfaction working with a mission-oriented organization and to be a part of a team. Over the past several months, I'm getting to learn the talents and abilities of the staff that work with me, as well as the talents of the members of the finance team. One of our goals in the general accounting area is to improve the close process, to look for ways to make it a little bit more efficiently, maybe a little bit more timely. And we're starting to see some of those benefits. We've recently began using a more automated journal entry system, where data is transmitted from one person to another with various approval levels through an automated process. And some of the benefits that we hope to see over the next year is the completion of the financial information. It gives our leadership team an opportunity to see our financial position and maybe react to our financial position as quickly as possible. And it also gets information into various clinical areas and departments across the organization a little bit more timely. So anyway, we're looking forward to that and the challenges and opportunities along the way.
Awesome. Great. Any questions for Ben? Thank you very much. Nice to meet you.
And then the newest member of the team, he has been here for a whopping 3 weeks.
Almost.
Almost 3 weeks. He's on his 3rd full week now.
He moved to Weatherford.
He is not in Weatherford, but thank you for asking. He's actually in Keller. So he didn't ask before he moved to Keller, so he is experiencing the commute and 35 itself.
He'll move.
But, he has a son that is in his senior year of high school this upcoming year. So he chose Keller based on the school district. So, and I'll get into that in a little bit. But Marty did just relocate. And because the interview process is kind of top of mind for me, the cost accounting project is the biggest project on my team's plate for the upcoming year. Cost accounting is one of those items which it is what you make of it. There's lots of different ideas of what cost accounting is. To me, it is an accounting system. So it's difficult, and it was difficult for me to find someone who shared a vision of cost accounting that I shared. To me, it's kind of like a casserole, and your general ledger has the same ingredients as your cost accounting system has. And so from an accounting standpoint, a lot of times when you have a cost accounting system, it kind of bubbles over and you lose a lot of that integrity that's in your general ledger because you lose that reconciliation process and the integrity of the numbers, and it's complicated, but and a lot of that gets lost from one accountant to another accountant. But Marty's an accountant. He understands what my standards are. So during the interview process, we talked the same language, and we talked some basics, we talked some big picture, and I was really excited by his approach. And so anyway, we were lucky to get him. Marty got his accounting degree at Northern Illinois University, and he was in the Chicago area for 20 years in healthcare. The first part, he actually worked in Treasury, but for the last 12 years, he was in budget and decision support. Most of that career, for about 18 years, he was at Loyola University Health System, and most recently he was at President's Health System, again, both in Chicago. So, again, just moved to Keller. He's here by himself for a while his family settles things in Chicago. His daughter and grandkids are in Nashville. He has another kid, right, daughter? Okay, who is studying to be an athletic trainer, staying in Chicago, so at least you have a reason to go back home. And the son is moving here with you to finish up his senior year. So, lots of changes this summer for him. And I'm going to have Marty share a few goals. That's really happy.
It sure is. Well, good morning. Thank you for having us here. First goal, number one, is I got to figure out what it means to be a Texan. So that's
It won't happen overnight. It takes time.
it won't. I'm meeting a lot of people who transplant down here, so the excuse to go back to Illinois is not the snow. Thank God it is my daughter. But as Gina explained, as Sharon explained, the biggest goal is building a team. I've gone through this a couple of times with Loyola and Presence from scratch. I got a couple of good people on the team in budgeting right now, and really hope to add to that mix and have a state-of-the-art A-plus team. I think it's important to have A players on your team and hopefully people who are better than me at the end of the day. That's the goal. The system, it is an 18 to 24-month journey. There's no way to shortcut that. The hardest part is the costing. Putting data in a system will be, should be the easiest part. It's then what does it mean, and is it telling us what it should tell us? So the goal is to get the right system, get it, everybody in place to build that system and start meeting the leaders in JPS and get them what they need to evaluate the hospital. I feel great to be down here. I don't see it as a county hospital. I see it as a hospital on the cutting edge, which I think is really important. It serves a community, but it's doing everything else. It's got a mission and it's got a plan. And as I told Mr. Early at the LDI, I've not worked with a leader who has his passion and puts the patient and employees somewhat ahead of himself and what he wants to accomplish. And that is the main reason. I heard his 3 rules during the interview, and when I heard that and got the offer, I said, that's exciting. So, very glad to be here.
We're happy to have you here.
Thank you, Marty. Any questions?
Any questions for Marty?
Thank you.
You'll enjoy the winters much more here. You'll enjoy the summers much more there.
More humid there. Here it's dry, so I will survive.
Northern Illinois, the home of Tony Romo.
So yeah,
what
Marty,
Northern- yeah, I think so.
Marty has about 7 folks that report up to him, and he is budgeting, cost accounting, and all financial analysis and reporting. So I failed to mention that. And then the next lady you guys know, Katie Rutherford.
Morning.
She has been here 3 years in July. Katie is one of the people that I interviewed with way back when. And, you know, she made a big impression on me, just her energy and her excitement about what she did here. So it's good to have Katie. Of course, Katie is over all of the revenue cycle, which includes patient billing and collecting, Rhonda's group, which is about 50 strong. She's also over registration at the main hospital and at the emergency department. That is about 80 people. And she's also over eligibility. You guys have met Michelle Haynes. She's presented to you before, and that's about another 60. So overall, give or take about 200 folks report up through Katie's area. I had forgotten about this, but Katie also graduated from Texas A&M at Commerce
It is painful.
with a business
You cut me
degree.
deep.
Yes. And most recently, she had come to us from Children's in Dallas as the Director of Patient Access. So we're lucky to have her. She has 2 grown children. Her son is a Marine veteran, former Marine, right? There's no such thing as an ex-Marine.
He's in the reserves now, so.
Okay. Right. And her daughter is a paralegal, expecting her first grandchild in October. So that's exciting. From a personal standpoint, Katie volunteers at the Fort Worth VA Clinic, and she is the president of the Dallas chapter of Blue Star Mothers of America. So very active in that organization. So I'm going to let Katie share some of her goals for her 3 areas as well.
Good morning.
Good morning.
Glad to be here. Okay, so for patient financial services, our goal this year, and continued goal, is to increase collections by decreasing denials. We have a denials prevention task force, multidisciplinary, that Rhonda Johnson leads, district-wide. So we have a lot of energy, a lot of forward moving, and as you can see, our collections continue to raise. And so that's our number one thing, is to make money for the district. For eligibility and enrollment, you know, don't tell anybody, that might be my favorite, but I forgot we're on TV, so.
You just told everybody.
So eligibility and enrollment, my passion is to help the indigent folks of Tarrant County. And Michelle Haynes and her team are doing some phenomenal things. We have focused outreach to increase our membership with Connection. We are members, she and I are members of the Tarrant County North Texas Enroll Coalition to increase marketplace enrollment. And we are also the only Tarrant County community partner with Texas Medicaid. So as you see, our goal is to find the right payer source for our patient population, whether it's Medicaid, the exchange, or Connection. We want to fund all of our patients so that they don't continue to use the ER, but can go to clinic appointments just like the rest of us. For patient registration, patient access, we continue to enhance our build with Epic and standardize our processes across the district. So we have a lot to do, but this is a really great time to have some forward movement in revenue cycle.
Awesome. Any questions for Kate?
I just want to
Yes,
make
sir.
just one comment, just to, I don't think I've said thank you on this, but just to know about the excitement that comes out of that division. I had a young lady who, out of my church, who was going to college, and we were trying to get her health care coverage, and so I sent her to see if she could come through JPS Connection. They was not able to do that. She's being raised by her grandmother, but when your team got through, they were totally excited about JPS and what y'all were able to work out. And she did get coverage. Michelle went all the way and talked to the school and all of that she didn't have to do. And just to say thank you for that.
Thank you.
Awesome. Thank you very much, Kate. Oh, TT.
Just quick comment. I mean, this is a subject that always created noise when I first joined the board, and you guys found a way to take me away from asking those questions, so doing a good job. Thank you.
We all thank you for that. No.
DT's good, I was gonna say. Obviously, you didn't answer DT's questions, that's what I was gonna say.
Thank you, Katie. So I encouraged, Sharon and I were talking about this the other day, and I encouraged her to, and she's a big cheerleader for her staff, so she didn't get this from me, but I encouraged her to bring as many of her staff to the board as we could, to the committee. You know, we realize we have great leadership and strong leadership. But we also realize, and we need to realize or remind ourselves what it takes to be successful, and that's a really strong team. And we're so fortunate to have such a strong team. And I just want to thank you and thank everybody for that. It's really phenomenal. Makes what we do real easy.
Yeah, Mr. Chairman, not that I'm a fellow UT grad, so I'm not gonna say anything about the Aggies while I'm here, but, yeah, I was gonna say, sorry, Sharon. I was gonna say one thing Sharon indicated when she sat down, that today is her one-year anniversary. And obviously, we've had the pleasure of working with Katie, as DT said, for 3 years with the organization. But when you look up there, you see Gina and Ben and Marty, and you see their backgrounds and their qualifications adding to the team. You know, people like that come to an organization because they want to be here. So again, I want to, like you just said, Mr. Chairman, I commend what you've done. You've taken a great staff and you continue to add to it. And so from that standpoint, I think we're very, very pleased. Thank you so much for what you've done.
Thanks.
No Aggie jokes or Weatherford jokes, I promise.
I thought the reason you were introducing the staff and all that today, because Steve wanted to justify his position as chair of finance.
My sub-reason, yes.
No, Ralph, notice when she was hired in May of last year.
You know, I had a wonderful mentor for 23 years of my career. So if I did not learn anything else from him, it was always hire the best person you can hire for the job. You know, go out and recruit someone smarter than you, someone that will always challenge you, someone that pushes you. And I've always, you know, that's often a difficult concept, especially when you're younger in your career, to do that. So I've got a great team, and I enjoy working with them every day. So thank you for letting me do that.
Good group.
Okay, on to the financials. We had a very good month for April. We have, you know, April looks very similar to my report from March. Admissions were down slightly. It is an unfavorable box in red. However, we only missed admissions by about 1% this month, so they were right on target. Our case mix index was up slightly, almost 3%. So our patients were a bit sicker this month than budget. And our patient days were favorable, and our length of stay was actually down by about 3%. So again, most of our inpatient statistics were right on budget or favorable.
What changed, that dropped the length of stay?
Go to the microphone.
I was just wondering what changed that constitute the drop in that length of stay so quickly?
On the length of stay, looking at the chart, it's really kind of a scaling thing. If you look at the left scale, it looks like an enormous drop, but if you recall from our discussions last month, the actual is for March is 5.5, and this month is 4.8. So it's really dependent on, and the scale on the side is actually 5.8 to 4.0. So the drop is based on the patients that were discharged during the month of April. So last month, in March, we actually had a high number of patients that were discharged with greater than 20 days length of stay, which kind of skewed last month's. So this month was much closer to budget and closer to what we had expected. So if there was one month to explain, I would have said March was a bit more unusual. And even back in February, I believe we had one patient that had been in the hospital for almost 12 months. So it just depends on which patients get discharged when you look at the average length of stay for that 1 month.
We can come back to this one.
Okay?
The reason I asked that question because I just want to see if there's any link between that and observation. Because I've seen observation go up. And
Now-
that may create some challenge for Medicare if they don't have dual eligibility. Because, well, we'll follow up on that later.
Okay. Now, again, just for everybody in the room, DT was asking about, did this length of stay graph have anything to do with the observation graph that's going to be on 2 slides from here. And DT probably knows this, but the observation days do not go into the length of stay calculation at all, because observations are an outpatient statistic, not an inpatient length of stay. So when we get there and you have another question. From an outpatient standpoint, we had a very strong outpatient month. Our emergency room visits were trending 7% above budget. You can see year to date, that is about where they've been every month this year. We've been very busy. Urgent care was just slightly unfavorable for April. And our clinic visits were under budget, but they were about equal to February. If you remember March, we kind of had a spike up in the clinic visits. So those trended back to February volumes. So some of our other key statistics, observation days were trending up. Again, they are trending above budget by 17% this month, which is where they have been this entire fiscal year. Births are down by about 14%, which is the trend for this fiscal year. And both our inpatient and outpatient surgeries were very strong, about 7% over budget for inpatient and about 20% over for outpatient. And this slide is all about our psychiatric services that we provide at JPS. Our patient days is down slightly, about 4%. It is equal to the prior month volumes. Our emergency visits are over budget by about 7%. Our clinic visits are over by about 10%. And our partial hospitalization days are over as well. There was some question about what happened with a spike in that graph last month. And after talking and doing a little bit of research, the trend line probably should be a little bit more gradual from December, January, February, March. There was a slight change in the way that we are charging for those patients, but we are also starting to get to full capacity on the 4th clinic. This is a district project. There's 4 locations. And in talking to our VP over that service area, from the first quarter to the second quarter of this year, there's probably about a net 20 patient gain that is causing that increase in visits. And each patient does attend that clinic for about a 2-week period of time, 5 days a week. So that would be the spike in that first quarter to the second quarter. Our FTEs per adjusted patient day are favorable, both of those calculations. And from a rev cycle standpoint, our days cash on hand remains right at 300 days. You can see it's starting to slope downward after we had received most of our tax revenue in January and February. And our net AR days are down to 44. There's our payer mix slide. It does not change month to month drastically, but it's a nice reminder of what types of patient comprise who comes through the door at JPS. Our JPS connection enrollment slide, this is always a crowd favorite. However, it does look like it is kind of tapering off. We may have well found our sweet spot for our enrollment activity. We are still doing the same things we are doing out in the community. We still have lots of people who disenroll each month. We still have lots of activity of re-enrollment each month. It's just the net numbers are starting to level off. So without a large economic change in Tarrant County, either direction, we may not see a large increase. You know, about 6 months ago, we were talking when Michelle Haynes actually presented to this group, where do you think we're going to end up with our connection enrollment? We thought maybe it was 38,000. You know, was it 40,000? I think somebody, you know, dropped the gauntlet and said, let's go for 40. And it might be around 42,000. So, you know, we had a net pickup of about 18 members this month. So there's lots of activity going on beneath these net numbers. But we have maintained it about 42,000. So we'll see over the next quarter where we land. So again, for this month, this month's activity and outcome looks very similar to the March activity. When you look at net patient service revenue, we ended up about 972,000 ahead. Again, most of that is volume. There's a little bit of pickup due to the inpatient increase with the patient acuity being higher, but most of that was in the outpatient areas, again, in the surgical areas, the ED, and in our invasive lab, which is new for this year. We also had a nice pickup in other operating revenue. We're about $822,000 ahead of budget. If you recall, last month we were talking about a patient drug grant. We had a large pickup year to date. You see other operating revenue overage as well as a supply expense overage. Those are offsetting. It's a zero bottom line impact. However, we had a year-to-date catch-up in March. This month, we had about a $750,000 income and expense item. The interesting thing about this grant is it also covers a new hepatitis C drug, which is very effective, but incredibly expensive. Sounds like most of you are aware of this. And it's a 3-month treatment. It is over a $50,000 cost for each patient, but it is very close to a total cure for hepatitis C symptoms. It's the most effective treatment for the patient, and this will continue on and will be over budget and at least for the next 3 to 6 months. Now next year we'll know to budget for that increase in income and expense for that grant. But those patients are starting to go through our clinic. So that will be a continuation. And then also in other operating revenue, our meaningful use monies were received. We had accrued to receive about $500,000, but we actually got about $750,000. So there was a pickup of about $250,000 for EHR monies in this month. So that was good news.
Sharon, where did the grant come from for the hepatitis C?
It is called the PAP grant.
Okay.
So does that, I can have a conversation with you offline, but it covers our outpatient clinics, and it mainly covers vaccines, which are a lot lower cost.
But it's a federal program.
Yes,
Okay.
I believe it is. Federal? Yes. From the expense side, not much to report there. The biggest variance is in purchase service. There is a $2.7 million savings in the purchase service expense. About $1.5 million of that is in contract services. Again, we had expected to be in a different place with some of our facility planning, and then we have a lot of IT projects that have been slightly delayed, so there are some savings there. And then because of some of the slower volumes, some of our physician payments are also lower than budget. So for the month, we have 2.7 million operating margin ahead of a $1.3 million budget. Any questions on the financials for the month? One thing I did want to point out on the next page, we don't often cover this page, but just from a format standpoint, a claim. Everybody remember a claim?
Charlie, do you remember a claim?
Yes.
Yeah, okay.
We are going to start reporting. It had activity beginning May 1. We will be adding a column to our combined income statement. So when you see this, we will have in the month and the year to date, we will begin to have a claim column. And that will start to roll into our combined activity. So as we progress throughout the rest of this fiscal year, activity in PG will start to diminish. Activity in a claim will start to pick up. And you will start to notice the changes as those roll through. So we will be working through the reporting over the next few months on how we report PG versus a claim to this board. And again, we will bring that back to you next month, so it may look a little bit different.
Great.
I just want to have follow-up. I'm glad that you have that observation chart for us to look at. I think we may want, it might not be appropriate for this, but
You want to speak into your mic?
it might not be appropriate to discuss, but we may want to look at that inequality. Because when you have a Medicare patient and you have a high observation, and they're not, if they're not an inpatient, admitted patient, they're out of pocket, unless they have dual eligibility with Medicaid, the cost can be substantial for a patient. And the follow-up care at nursing home, all that stuff may not be reimbursable. And they'll be surprised from a financial standpoint, so we may want to take a look at that from that perspective.
What will that get us?
It's the challenge, right, because sometimes hospital push, the doctor may push because of quality, push it forward to observation. To reduce costs also as well. And, if it's done right, it's fine. If it's not done right, it could be a very expensive for patient, surprise for the patient, because their copay out of pocket and all that stuff is gonna be very high. And their follow-up visit with the physician also subject to copay and all that stuff also as well.
But would we have that kind of data? I mean,
kind of, but
Well, an observation, and we may need to talk after the meeting, but an observation is defined by medical necessity versus the inpatient stay. So it's not an option whether the Medicare patient is an observation or an inpatient stay. You're just, is it a notification, but
yeah,
we
that's,
can,
that's why we talk about, let's talk about that in quality to make sure.
okay,
It's not financial
okay.
subject on it, but I'm glad you show it there so we can keep an eye on it.
My my biggest, one of my bigger concerns is, as you try and drive down length of stay, what will happen to readmissions? Because the push is to get people out of the hospital as quickly as possible.
Not the push should be to get them home.
I would agree with that, but there'll still be readmissions.
Yes, and, you know, depends on how you look at it. Sometimes it's better because of DRG. Sometimes it's better to keep them at the hospital. It's not good for the hospital, but if we, you know, it's for as far as for connection, right? If they stay in the hospital and they go home, the cost probably less than just bouncing around to rehab skills and readmission and all that stuff. So it's just the whole totality. I mean, nobody have a perfect answer. I don't want to raise any alarm here. Just how do we re-engineering and to keep an eye on certain things. That's,
Right.
it's not a concern. It's just more of can we do better than most of people. That's what we
Sure.
want to do.
Sure. That makes total sense.
Yeah, one other question I would have about observations is how long are they actually staying in observation? Is that 24 hours or 4 days or?
You know, I'm gonna kind of speak off the cuff, but I believe most of our observations are less than 24 hours here. From a Medicare standpoint, I believe an observation can be up to 72 hours, so up to 3 days. I'm not sure from a statistical standpoint what our average is and where we fall, like from a quantity standpoint, but I think from an average, we are under the 24 hours observation.
It's
that
creeping
right?
up to 2 point
Anybody
something,
got that?
but it's also include psych in there, so it's kind of hard to tell.
Hard decision,
Right.
okay.
Okay. We're going to do PG. Good morning, Maria.
Good morning. Well, I wished I could sit before you and tell you that we had a fantastic month, but unfortunately, we did not meet our encounter budget. It wasn't due to the fact that there were not encounters there. It was done. It was just that, you know, I think there were some things with the move, et cetera, that the revenue cycle team was not able to do what needed to be done, and that's okay, because it's gonna be there this month, of course, so. So we were short on our building counters. Let's see. Oh, thank you. And so for the month, we had 27,592 compared to a budget of 29,329. And of course, our internal for the departments, for the month, we were short for all departments, but then on a year-to-date, our internal medicine and oncology departments continue to beat budget. Family practice is close, and then, of course, pediatrics, we do have a variance there. Let's see. Net patient service revenue per encounter, of course, we didn't meet that either, and we haven't. But on the net operating expenses, we continue to beat our budget there. So we continue to monitor our expenses quite well.
And days cash on hand, we're at 256 for the month. And then our AR days are at 19, so they continue to be around the 18, 19, 20 days. The payer mix, we did change it for this month, and we did break out the managed Medicare and the managed Medicaid. And we did change the colors to match the hospitals, so that's been done. And our payer mix continues to be the same from month to month. So just going through the income statement, just at the bottom line, you know, we did make a profit, 32,000 for the month, compared to a budgeted profit of 253. And then, of course, year-to-date, we have a 672,000 loss compared to 2.3 million. So on a year-to-date basis, we're continuing to exceed our budget. And I do believe this is my last presentation to all of you, since Acclaim is in effect May 1st. I do want to thank all of you. It's been a complete joy working with all of you. Thank you for giving me the opportunity. And I want to thank Bill Johnson. He's been phenomenal, a great leader. I've enjoyed working with him very much, and all of you. And I know that Acclaim will be a very successful endeavor, and thank you very much.
Thank you, Marianne, very much. Any questions for Marianne on that presentation? Great, thank you very much.
Thank you.
Thank you, Marissa.
Okay. We ready? Entertain a motion for approval to receive the
Second.
motion. We have a motion by Dr. Weber, a second by Reverend Emerson. Any further questions? All in favor say aye.
Aye.
Opposed? Motion passes. Thank you for that. All right, let's get through these contracts. We should be able to knock these out fairly quick. No major surprises that I've noticed, unless Scott's got a surprise for us.
Definitely got a surprise.
Oh, you forgot your name tag, Sharon. Go ahead, Scott.
Good morning.
Good morning.
The first thing to consider for approval is an extension of a lease, 2-year lease. This particular property is at 501 West Main in Arlington. It houses one of our partial hospitalization programs. We've actually been in this space since 2004. The reason for the extension is it would best correspond with what we think would be the funding for waiver.
Any questions for Scott on this? Entertain a motion for approval.
Move.
Motion by Reverend Emerson,
Second.
second by Mr. Powell. All in favor say aye.
Aye.
Opposed? Motion passes. Item B.
Great, thank you. The second request for approval is a 3-year extension for a lease on 200 West Magnolia. You probably know that Magnolia building is directly across from our JPOC building. That space is used primarily for IT training, specifically around Epic and new software applications. I think we also do some budget training there as well. In addition to the 3-year extension, we will also be taking, or we also recommend taking another approximately 1,000 square feet that is also opened up at that location. Once again, this is within walking distance, literally across the street from JPOC.
Any questions for Scott? All right, entertain a motion. Motion by Reverend Emerson,
Second.
second by Ms. DeBose. All in favor, please say aye.
Aye.
Opposed? Motion passes. Thank you, Mr. Rule. Oh, question?
Yeah, I want to ask Scott, of the number of properties that we lease, especially in the immediate area of JPS, is it more cost effective if we look long range to those become our properties as opposed to continue to lease? Or is it better to keep leasing?
Yeah, with each property, you know, you can do a net present value to see which would be more beneficial to lease or to buy. Certainly, our evaluation over the past couple of years has been within the context of what we might do with long range in terms of development on site with the land that we currently have. So that also factors into the equation.
So,
Yeah, that didn't answer your question.
He is a lawyer, so you know that, right?
so then as we look long range, which side of the benefit would be lease or continue to lease or look to purchase?
So I'll try to answer that more specifically. And going forward, we can certainly do a net present value analysis to do a site-specific analysis as to whether it be most beneficial, long-term, to rent or to buy. And then part of that discussion would also be, is that particular use of that building contemplated in our long-term building plans? But we can do that on a site-specific basis, because it depends on a lot of things. Obviously, the potential purchase price of that particular building, the amount of rent that they're gonna charge. Is there any tenant improvements that we might need to invest in that building as well? So all those factors would go into that financial analysis.
To add to that, let me tell you what partially is happening, and help me on my north, east, and west. The little restaurant used to be Chandra. Is that to our north? Where is that?
To your west.
To the south.
Yeah.
Areas to the south where we are probably not looking from a facility standpoint, those properties seem to be more in our price range, but not in our continued footprint of where we want to grow.
Okay.
The areas that are more enticing to us, such as leased space right across from JPOC on Magnolia, they have become quite proud of. So it's inverted, where we would like to buy, the cost is a little bit higher and may be cost prohibitive to us. In the areas where we don't want to expand particularly, and doesn't fit our facility plan, prices are a little bit more affordable for us. So it's a bit of a challenge to look at it. We've sort of taken an approach right now to continue to lease in some of them, but be cautious for wanting to see where our facility and plans go for future growth and future build-out. If we don't have the opportunity to have the kind of expansion plans that I think a lot of us want, then we'll make do with some of those properties a little bit differently. So I think a little bit of it's time. The other thing is, as we do expand, it's a little more challenging to get places that are leasable right next to us. And it makes tough sense when your IT department is growing, but they're over by South Campus.
Right.
It doesn't make a whole lot of sense. So to answer your question, it's a little bit yes and no, because where we can get available, it doesn't fit our plan, and what fits our plan is a little more expensive right now.
Then, in the study that the consultants are going, will that play a part in that study, or will they be addressing that?
I think what they'll do, my attitude towards the consultants' work, is they'll look at what we've already done, because we've outlined where our footprint is really clearly.
Right.
And if you'll recall, when the old VA facility was opened up about 12 blocks, 14 blocks from us, we weren't as excited about buying that because it was totally out of our footprint. Didn't make a lot of sense. I think we have a hard time justifying to taxpayers that we wanted to buy something, but it really doesn't fit what we've actually looked at on the facility plan. So the consultant that the county will work with, I think we'll go back and look and do a lot of verification of what we've already done in that, because we can show the community and our taxpayers clearly where we think JPS's growth is. Of course, every time we tell people where our growth is, prices tend to go up.
Go up.
That's always interesting too.
Thank you, Scott. Diana,
Good morning.
good morning.
The first agreement I have before you today is an approval of a First Amendment to our professional services agreement with Jay Taylor. This is the work that's being done to establish a pay-for-performance compensation program for our physicians. Thank you, Sharon. And so this is, again, a First Amendment. There's been a lot of work done. We're expecting that to cap at about 156, and then that work will extend beyond this fiscal year. We are budgeted this fiscal year for up to $450,000 in a claim, and this will exceed a little bit beyond that.
Okay. Questions for Diana on this piece? Entertain a motion for approval? Motion by Dr. Weber,
Second.
second by Reverend Emerson. All in favor, please say aye.
Aye.
Opposed? Motion passes.
Thank you.
Item E.
Okay, I've got another agreement in front of you. The next agreement is for professional services. This is a third amendment to professional services contract for Dr. Robert Rogers. He is our allergist in the community. We transitioned our patient care to him a few years ago. He does wonderful work. I'm happy to say we've had no patient complaints in the years that he's been doing work for us. And again, this is a fee-for-service contract, so as patients go, we pay, we're expected to be about $48,000 this year for those services.
Heard the explanation. Any questions for Diana? I'll
Move
entertain
approval.
a motion by Mr. Bose, second by Reverend Emerson. All in favor, please say aye. Diana, before you go on item F, which is related to, I just wanted to clarify
Yes.
the item as it's listed in our agenda. It also relates to Dr. Rogers. So if you would just picture for yourself after the word physician services of Robert Rogers, MD, just insert that because it's associated.
Okay.
Does that get me out of trouble, Counselor?
Yes.
The next item before you is to transition the contract between Robert Rogers and the district to be managed by the Acclaim Physician Group. If you remember, part of the goal of the physician group is to assign those contracts to Acclaim so that all of our professional service contracts can be managed within Acclaim. And Dr. Rogers will be one of the first contracts to transition to Acclaim for management.
And Mr. Chairman, I'll just make this notation. Chairman Emerson and I actually sat on the executive committee for Acclaim. We met on Monday, and this contract was discussed. It is one of the first assignments in. So as you so indicated, all we're doing is taking what was just approved in item E and assigning that directly into Acclaim. So
Correct.
that clarification was also made at the Acclaim executive committee also, so.
Great. Any questions for Diana on this one?
Move approval.
Motion by Mr. Bose, second by Reverend Emerson. All in favor, please say aye.
Aye.
Motion passes. Oh, please, all opposed? Motion passes. Just had to give the opportunity in case somebody. Thank you, Diana. Mr. Skillings.
Good morning. The next item is a contract for our insurance broker services. We went through an RFP process over this past several months to evaluate our insurance broker services. We selected Arthur Gallagher and Company to replace our incumbent Aon, who served the district for the last 5 years. Arthur Gallagher gave a very compelling presentation, not only with an attractive fee of the $68,000 per year. One of the things I'll say in the contract language of working with General Counsel, so that the contract didn't read as being evergreen language, which is how it was originally. It reads as $204,000, which is a $68,000 times 3 years, so it's a 3-year agreement with a 2-year option to renew, which is consistent with what we did with Aon when they were our provider. And so we made that change with General Counsel and Gallagher, and they were accepting of the change. So I just wanted to make that, because it's a little different from what I have in my executive summary.
Thank you.
One of the other factors of choosing Gallagher as our new insurance broker provider was they are going to provide our existing slate of insurance coverages that we have historically had, but they have some compelling new products that, as the risk profile of the organization changes, particularly around billing and regulatory compliance products for loss coverages around breaches and around regulatory investigations from outside agencies. That's coverage that we currently don't have. I don't necessarily say that we necessarily need to get it, but it's something that we should evaluate when we look at our risk profile when our insurance policies come up for renewal this fall. And then the last item I would say with Gallagher is they did show a good commitment to business supplier diversity. I think we didn't. I don't know if we were on the board necessarily in terms of spend from a diversity standpoint with Aon, but we did get a commitment of 10% spend with Gallagher on a $68,000 fee, and even though they don't track their second tier spend, they did give us agreement they'll work to do that. So I think that was showing good faith on their part. So that's the presentation.
Any questions for Ron? I'll entertain a motion for approval.
So moved.
We have a motion.
Second.
Motion by Reverend Emerson, a second by Mr. Bose. All in favor, please say aye.
Thank
All
you.
opposed? Motion passes. Thank you, Ron. Mr. Mendenhall, spending money again. What you got?
And according to Sharon, we have plenty of it, according to her report.
I
So
heard her
I'll be
say
happy
that.
to
I heard her
continue.
say that.
You heard her say that, I heard that too.
You're gonna change that right now?
Absolutely. Sorry about that. So in front of you, you have a proposal to increase our storage that we have in our data centers. This is an all-flash array. It's the newest technology of storage that we can purchase that will increase our Epic, our Lawson, and all of our tier 0 and 1 apps that we have. This is about 722 terabytes worth of storage. Should get us a buy for about we're hoping the next 1,000 days with our growth rate that we have. So we're not actually budgeting in FY17 as storage increase. So this will do that. The only reason why we purchased that much right now is because some of the pricing that we received from Hitachi and from Luminate on this deal. And you can actually see that we initially budgeted 1.9 million. We were expecting a 50% off a list discount, and we ended up with a 65% off list discount. So that's why it's under budget at this time.
Awesome. Very good. Any questions for David on this? Entertain a motion. Motion by Reverend Emerson, a second by Mr. Powell. All in favor, please say aye. Opposed? Motion passes. Thank you, David. And we have nothing for closed. Any other presentations, Dr. Weber?
No, we'll wait.
Yes, sir.
This is, I hadn't talked to CEO about this, but earlier when they talked in the contract, and they talked about tier 1 spending, tier 2 spending, I think that would be, informational and helpful if at some point the diversity office could make that presentation to finance, that we would see the greater benefit that's taking place with the tier 2 spend when it comes to diversity.
I agree.
Let's do that.
It was really impressive when we saw that.
I didn't even know what tier 2 was
Well,
until the diversity session.
Yeah, I'm
We
not
can- that's
really
a- that's a
familiar.
great- That'll be a good report tonight. Thank you.
Yeah, I'm not real familiar with it myself, so I'd love to hear
Now,
that.
Ralph, we just talked about that because go ahead.
Gallagher has some work to
Yeah,
do.
Dorothy and I pulled those numbers, I showed her, she had, we agree with you, I think it'd probably be a better way to present it. So,
Okay, all right. Any other items?
this
With
guy
that,
just got away.
we're adjourned.
Yeah.
Thank you.
Illinois company with a
With no flags.
Okay.
You just missed the meeting.
Sorry?
chairman adjourned. Yes, sir. It's the chairman adjourned. This man is official. Yeah, I got Illinois company with a